I'm Dr. Leslie McElrath of Monarch Ideal Care in Akron, Ohio, and this is stuff no one teaches you, Doctor Edition. So, today we're going to talk about the difference between health insurance and health care because they are two different things. A lot of people conflate the two and make it seem like they're the same, but they're actually not. Health care is provided by your physician, so like an MD or DO, by a physician assistant or a nurse practitioner. The people that actually are taking care of you, answering your questions, listening to you, doing a physical exam, those are the people that provide health care. Health insurance is just a way to pay for those services. And it's not the only way. A lot of people think that health insurance is the only way that you can pay for your health care, but it actually isn't. There are other options like direct primary care, which is usually a subscription model. So you're paying every month to have access to your provider. Concierge, which means you are usually using your insurance, but then also paying a monthly fee to have access to other things like newsletters, extended hours, telemedicine, things of that sort, or just paying straight cash for your office visit. So, like talking to the office manager before you have the appointment, asking them how much it's going to cost and then giving them money and never hearing from them again. That is an option, right? And so the question is always, why is healthcare cost so much? Is that the reason that we need health insurance? Well, actually, and surprisingly, the answer to that is the reason that health insurance costs so much is because of how payments are completed. With health insurance, it can take upwards of 3 months, as low as, for me personally in my private practice, as low as 1 month to get paid and reimbursed by insurance for the services that you provided. And so, if I'm getting paid a month after I provide services, how am I going to keep the lights on? You keep the lights on by either raising the prices, accepting more patients into the practice, so that's why you can't get into your doctor's office, or adding on additional services. Healthcare does not have to cost as much if people are doing things in a reasonable way. So, how do you lower your healthcare costs? You consider something like paying direct cash for it. Literally, call the office first, ask them how much it'll cost, and then paying that. Uh, Finding a direct primary care doctor. Hi, I'm Dr. Leslie. I have a direct primary care practice, which means there is a monthly fee associated with being a part of my practice. But when you pay that fee, that covers everything that we do within that month. Now, that also means that if you don't see me in that month, you still pay that fee because that's keeping me available to you. But it means that if you need to see me 5 times, you've paid once for 5 times. That's how that works. Concierge, I also do that. Yes. Concierge is when you use your insurance to pay for the office visits, but you're paying to have extended hours, have weekend availability, have access to my cell phone number so you can reach out to me directly. Like those services have value. And for people that value their health, it's worth it. So, health insurance, healthcare, two completely different things. One helps pay for the other. That's why they're different. Bye.